another episode of the Liberty Dad podcast, a discussion on politics and culture. I'm your host, DL, America's most objective libertarian. If you're tuning in live, thank you so much for giving me your time. This is Liberty Dad versus Mamdani's policy. This week, we're going to focus in on safety. So let's pull this up here, and I'm going to read it to you. That way we have a bit of a foundation of, just in case you're listening in the background, you know exactly what I'm referring to when I make commentary. Also, I want to make sure that I'm using his words. So his words, his ideas from his policy platform, right? I'm not going to somebody else who has determined their perspective about him and written it and then just regurgitating it. I have come to my own conclusions, and hopefully they're good ones. You be the judge. That's okay, my VA lady. I get you. I was probably, my VA lady helps out tremendously on the show. Make sure that I'm on time, doing things the right way, offers tips and advice. So if you're in the podcast realm, you might reach out to her. And she was just letting me know that, she was politely letting me know, hey, you didn't really communicate so well. Because had I let her know, she wouldn't have had to send me text going, hey, I don't see this and that, whatever. Okay, anyway, let's get into this. All right, so here's what he says. And he's got a video here. We'll play the video in just a moment. All New Yorkers deserve to be safe. Fair enough. But the Adams administration has failed to deliver the sense of safety and security that everyone should feel walking down our streets, riding our subways, or taking our buses. Now, if you're not in New York, he is running against Mayor Adams, who is currently the incumbent. So you'll see a lot of references in his platform towards Adams because he's literally running against him. Okay, so Zohran will create the Department of Community Safety to prevent violence before it happens by prioritizing solutions which have been consistently shown to improve safety. Okay? A little sketchy there if you're of the Minority Report type, and you watch that movie and you're like, okay, preventing things from happening. But there are arguments to be made that if you do certain things, it will direct people onto a different path for which will not be a criminal one. And so therefore, if they go down this other path, then they won't become a criminal. You have reduced crime. All right. So and as far as I can tell, that's what he's getting at. He's not talking about any kind of pre-crime or anything like that. He's just like, look, let's address the issues that lead to crime, right? People don't just commit crime necessarily for no reason. It may not be a good reason to people like me and others who oppose it, but for those who are engaging in it, they have some reason. So work on taking that reason away. All right. Let's see here. Police have, highlight this a little bit. Police have a critical role to play, but right now we're relying on them to deal with the failures of our social safety net, which prevents them from doing their actual jobs. Through this new city agency and whole of government approach, community safety will be prioritized like never before in New York City. The department will invest in citywide mental health programs and crisis response, including deploying dedicated outreach workers in 100 subway stations, providing medical services in vacant commercial units, and increasing transit ambassadors to assist New Yorkers on their journeys, expand evidence-based gun violence and prevention programs, and increase funding to hate violence prevention programs by 800%. Read more in the New York Times and the full proposal here. So we go on over to the New York Times. I'm not going to read the whole thing. It's titled, Add More NYPD Officers to Fight Crime, ? Mamdani has different ideas. Many of the candidates for mayor of New York City support hiring more police officers. Zohran Mamdani has a different public safety plan. So we go down here, and I'm just going to read you this highlight because I think this is kind of useful. We'll skip down to it. All right. Mr. Mamdani said that he would pay for the additional cost related to the new agency and for his broader affordability proposals by raising taxes on wealthy residents and large corporations and through a better use of existing city funds and stronger enforcement of tax policy. Okay? So right off the bat, as a libertarian, I've got red flags going because I'm like, oh, wait a minute. You're talking about additional cost and you're talking about raising taxes on the wealthy and large corporations who can move if they so choose, right? Or in many cases, a lot of people argue and say they get their lobbyists together and they go write, they go help get their lobbyists to write legislation that kind of adds in some sort of loophole for them, or there's existing loopholes for which they use, and then they shelter themselves from paying taxes. So the real question is, for those that believe in this idea, if this happens, if he raises the taxes on wealthy residents and large corporations, what are the potential consequences, and how does that figure in? So far as I can tell, that answer has not been laid out anywhere. Now, it might be, like he might have been on an interview where somebody asked that question and I just didn't see it. I can't see everything. But as far as I've seen, I don't see an answer to that question. And that is vitally important. We have to know, okay, not every wealthy person is going to leave, nor is every wealthy person going to necessarily stay. So the real question is, how many of each will come and go? Because then you have to figure out, okay, well, what if, 50% of everybody making $5 million, that has an income of $5 million or more, or has a net worth of, $10 million or, whatever, right? Like, how many of those people will leave? How many will stay? What is the impact to the bottom line? Because you have to have money to pay for things, period. And so you have to be sure of a revenue stream. If I go out and I say, I'm going to do this thing, and then I don't have a revenue stream lined up for it, I'm looking at potential failure. I just criticized Alligator Alcatraz because they built it, paraded it all over the media, and then when you watch the video with Ron DeSantis and Donald Trump and several other people, you find out that they are expecting I think it was $150 billion from the I keep wanting to say Build Back Better, the Big Beautiful Bill, right? So now it passed, so they are going to get it. But there was a question at one point of whether it would pass, and it wasn't clear. And so then they would have built this, facility, whether you like it or hate it. They built this facility that requires money to run, and they did not have their revenue stream guaranteed, as guaranteed as much as you might, given the space that you're in, right? Like if you're on the free market, you have no guaranteed revenue. You just have, whatever research you've done that says, okay, I think the market will support this and will want this product or service that I'm providing. But in government, it really isn't about, okay, will the market bear it? It's, are we going to have the revenue stream from government because either they've implemented a new tax or they've found a way to shuffle money around and ensure that, we get this money instead of somebody else or some other entity, right? So you should never advance an idea until you've secured funding. That's just kind of simple. Like it's pretty simple. You don't get any more simple than that. Okay. So I'm not going to read this article. You can go read the whole article because what I would rather do is actually dive right into his proposal. So I'm going to pull up the proposal on the screen here. And then we're going to just walk through. It's a 17-page proposal. We're not going to go through all of it. So I'm not going to read like line by line by line. But I am going to go through and I'm going to highlight some things that I thought were interesting and show you where I think that there are some serious issues. Oh, before that, though, let's watch his video on safety. So let's check out that video really quickly.
Every New Yorker deserves to be safe, and today I'm announcing a plan to deliver exactly that. Public safety is created by stable homes, good-paying work, and well-resourced neighborhoods. Addressing these issues are at the core of our campaign. But we must also aggressively pursue evidence-based strategies that prevent violence and crime before they occur. I will create a Department of Community Safety, the DCS. This new agency will coordinate a whole-of-government approach to protect New Yorkers like never before. We will invest in citywide mental health outreach and crisis response, expand gun violence prevention programs, address hate, and tackle homelessness. The DCS will make public transit safer, placing dedicated outreach workers in our subway stations, transforming vacant commercial units to provide medical services and connections to long-term care, and investing in transit ambassadors to assist New Yorkers on their journeys. There will be visible, trained teams in our subways. Their presence and their work will make all of us safer. Police have a critical role to play, but right now we're relying on them to deal with the failures of our social safety net, which is preventing them from doing their actual jobs. It's one of the reasons so many crimes are left unresolved. New Yorkers deserve a leader that treats public safety with the seriousness it deserves. I invite you to learn more about the Department of Community Safety at zohranfornyc.com/safety.
Okay. So you saw his video, and it's attractive, right? Like, I get it. It kind of makes me think, yeah, I would want that. Who doesn't want a safer city, especially in New York, where we know that there are issues on the subways? Who doesn't want to be able to feel more comfortable getting on the subway, going wherever they need to go, and then coming back home without an incident? Everybody would love that. So I think he's pointing in the right direction. But when I read through his proposal, I have a lot more questions than it has answers. And for me, that's a problem because I know government a little bit. I've watched it for 40 years. Okay, maybe not 40 years. Like, I'm 47, so I started paying attention when I was, like 15? So if I'm doing the math on that, it's for like 30 years, okay? So I've been watching government for about 30 years. And one thing that, like, everybody's all, a lot of libertarians are like, government doesn't do anything well. Well, yeah, mostly, but they do one thing very, very well. And that is promote the idea that they are effective very well. They talk about it a lot. We're going to do this. We're going to do this. We're going to do this. And then they fail a lot, right? Like, they're very good at both of those things. Very good. We're going to promise this and then not deliver for whatever reason. It's like that running joke. Whatever the title of a bill is, expect the exact opposite. Why is that? Well, that's because government has a reputation. So when you're wanting to do the things that he's doing, when you're wanting to spend the money that he's spending, I think it's time to start asking a lot of serious questions and saying, all right, what answers do you actually have? So here is his proposal. And I've made it as big as I can for the screen. Unfortunately, PDFs don't resize so well necessarily. So this is what we got to work with, what we have to work with. So I've highlighted a few things here. So the first three here, the Mamdani administration will bring down rent, repair housing, create high-quality, universally accessible transportation, fully fund our schools, ensure everyone makes a livable wage, provide universal childcare, and improve the material conditions of New Yorkers' lives. These policies will foster a safer New York. Now, I will say right off the bat, yes, in a sense, all of those things, if they're happening in a positive direction, do make the lives of citizens better. Okay, careful what I said there. I didn't say these policies necessarily by government, but I'm saying if you have rent that's affordable, if you have houses that are being repaired because it's affordable to repair them, if you've got transportation, maybe options, right? Maybe your car breaks down and you can catch the bus in a moment, in a moment of need, whatever. If the schools are funded well and producing good, good students who are getting a solid education, if people make decent money, if there's childcare, if there are just general better conditions in a city, all of that, I believe, fosters a safer city. The question is it government's job to do it? And are they capable of doing it? That's the question. Now, from a libertarian perspective, it's not the government's job to do it. And the reason is because government can be slow. It's full of bureaucracy. It's full of waste. But the slow part is one of the bigger answers that I think it's one of the more underrated answers when it comes to libertarians. Like, it's slow. It cannot turn on. If I am running a restaurant and I find out that I'm selling cheesecake and people don't like this particular cheesecake, like a lot of people order it, but then I start seeing the cheesecake come back, like people aren't eating it. And then then the orders start slowing down because word is getting out their cheesecake sucks. Well, then I know I need to make a quick change. Now, it may cost me, but I got to make a quick change. I've got to do something because maybe I sell my cheesecake to some other restaurant where people aren't as picky. Maybe any number of things, right? But ultimately, I'm going to try to get different cheesecake in, or I'm going to try to highlight other desserts and allow my current supply to run its course and then not purchase that particular cheesecake. or not make that recipe, or however it is that I'm doing it. Point being, I am making an immediate decision right away based on the feedback that I'm getting in the market. Government doesn't work that way. Why? Because when I talked about the housing issue, there's a housing board. They determine the rent. They determine a lot of rules that landlords have to abide by. This board is 9 people. They have to get together. They have to review information. They have to debate it. Then they have to vote on it. All of that simply takes time. It's not like somebody who owns a restaurant who can make a quick decision in the moment and move along and then, deal with the repercussions, right? Like city council or any body in the government, they spend their time working these things out. And a lot of times, if you watch and you pay attention to this show on Mondays when I do my bill review, a lot of the bill reviews that I do, what you end up finding out is that they actually don't do anything. A lot of them order reports, right? Like I did one on reparations, and the whole thing was about spending $12 million so that somebody could go and review information and provide reports to the president. No actual reparations were given, right? Like just, okay, we're going to give a report, and then the report didn't have to be acted upon. Like, so they could just give a report, and then bam, that particular legislation was successful because it did what it was supposed to do. They spent the $12 million, which is always what they're supposed to do, like as far as government's concerned. And then if they produced a report and they delivered it to the president, whether it was a good report or a bad report, it doesn't matter. It was a report. And if the president just looks at it and says, yeah, that's nice, and throws it away, okay, it was still successful. So you see the problem? Like, government doesn't really have the same incentive as the market to adjust accordingly and then figure out how to deal with the consequences, in many cases, the bad ones. So that's why I say, like, yeah, these things are good ideas. I just don't think they belong in the hands of government. All right, so we go on and he says, our city currently offers a patchwork of programs for dealing with issues like gun violence and mental health crises, but they are underfunded, inaccessible, or unable to produce long-term safety. Oh, okay. So now we're hearing the city already has programs in place, and they're not effective for one reason or another. That should tell you that you have some problem that has to be dealt with in government. There's a systemic problem. What is the problem? Why is it underfunded? Are you not getting enough tax money? Are you misusing the tax money? Did you not allocate sufficient amount? Do you need $1 million, but you said, okay, we'll give you 500,000, right? Like, all these are important questions. And they're in questions. Like, if I go back to my restaurant analogy, those are questions that I would have to answer. And I would have to say, okay, I've got all these systems, maybe not programs, but all these systems put in place so that my restaurant operates efficiently. And if those systems aren't producing the results that I want, well, then I have to go back and say, what can I do about it? And how quickly can I make this happen? Because my business depends upon the success of these particular like policies or whatever, these ideas that we have in place. Okay. And so they've got this patchwork of programs, but they're ineffective. That's already a red flag right there. All right. But let's continue. I've got a third little section here that I want to read. Scroll down here. The DCS will oversee moving the below existing city offices into department jurisdiction, allowing us to cohere these programs and fill cracks in our systems. The budget for the Department of Community Safety will be $1.1 billion. Okay. Approximately $605 million of which represents transfers of existing programs. Okay. So they're going to stick with the 605 that they're already spending. They've already allocated for it. And then $455 million of which represents new funding needs. So now you're going to need $455 million just for this program right here. Now I want you to take a look. Okay. I want you to look at something here real quick. Let me pull this back up on the screen. So put this over there. Okay. I want you to look at this really quickly. So this is just one item on his platform. He's got freeze the rent, affordable housing, landlords, safety. That's what we're talking about tonight. affordability, city-owned grocery stores. Who's paying for that? We'll talk about that next week. Fast fare, free buses. Who's paying for that? City. We'll talk about that next week. Fighting corporate exploitation. No-cost childcare. Somebody's got to pay for that. Baby baskets for New York's newborns. That costs money. Where's my little cash button? Cha-ching. K-12. Probably money in there, but the headline doesn't necessarily suggest it. Taxing corporations and the 1%. Okay, paying for our agenda. We'll talk about that eventually. We'll get to it, right? So that's his idea, because all these things cost money. Climate, green schools for a healthier New York. Okay, well, guess what that means? That means money. LGBTQIA plus protections, more money. Healthcare, more. Can I get it again? Healthcare, more money. Raising the minimum wage. Okay, well, as long as it applies to the city, well, then that's also going to increase wages, right? It won't necessarily increase the city's funding necessarily if, the corner store has to pay somebody $30 an hour. Regulating delivery apps and protecting delivery workers, small business, libraries, that's cost money. Trump-proofing New York City probably would cost money, but we'll get to that when we get there. Okay, so I point out to all of these because he needs $500 million just for this one, just for safety. $500 million right there, just for that thing. Okay, that's a big deal. Where's that money coming from? How guaranteed is that money? And this is my initial problem, is that we are creating yet another government department. Another one. You've already got all these ones. Like, he just said that you've got a patchwork of programs and they're not effective. Okay. Well, shouldn't you worry about the inefficiencies before you start creating new departments? And this is not the only department. In the housing, I think there were 2 departments that he was talking about creating, and they were going to do something similar. They were going to have added responsibilities, but then they were also going to consume the responsibilities of these other departments. So he's basically centralizing control, okay? And this centralized control supposedly is going to make the government more effective. But I doubt it. Why? Evidence. Have you seen government? They're not good at much of anything. All right, so we get into this, and let's see. His argument is our city currently offers a patchwork of programs for dealing with issues like gun violence, mental health crisis, but they are underfunded, inaccessible, or unable to produce long-term safety. That's from his proposal. Of course, we've just seen it here. What he doesn't address in this document, which is supposed to be, hey, this document tells you how are we, what are we going to do if you elect me? What he doesn't address is why those programs are underfunded, inaccessible, or unable to produce long-term safety, much less how putting them under the umbrella of a bigger department reduces those failures. So let's ask some pertinent questions. Why is there a lack of funding? And where will additional money come from? Like, guaranteed. You can't just say we're going to tax people more, because everybody tries to find ways to not pay taxes. Everybody. It doesn't matter who you are. If you're wealthy, you just simply happen to have more options available to you. If you're less wealthy, then you have fewer options available to you. But you still pursue, like, oh, child tax credit, I lost money on my business. You're looking for things, my car. You're looking for ways to reduce your tax burden. Because at the end of the day, most everybody is the same. They want the money that they've worked hard to earn. So that's one question, right? And he does have an answer, and we'll get to that eventually. What government inefficiencies has he identified currently, and what is the cost of those inefficiencies? I want you to think about that. Like he says, he's like, we've got this patchwork, and they're inefficient. Okay, how? How are they inefficient? How will your idea not fall into those same traps? How will your idea be better than what they currently have? Another question is, what does better usage look like? Well, it's kind of similar to the question I just asked, but like, okay, if we're going to use money differently, How are we going to use it? Like, it's one thing to identify and say, okay, using the money like this is inefficient. It doesn't get us the results. Okay, cool. Now that we've identified that, how are you going to use the money, and how will it be different? Like, what's going to be the difference? Which requires knowing precisely what was the point of failure for the current system that they have. Another question: what waste currently exists, and how much is it? So this one might be along the same line as inefficiency, but I think of them as separate. I think of inefficiency as, hey, you need to spend the money here. You're just not doing it wisely. You need to accomplish this task. It's like if you send me outside and you're like, DL, I need you to pick up all these rocks and carry them from one side of the yard to the other. Well, I could pick up the rocks and carry them one by one all the way across the yard, right? And that's a need, and I may be doing that inefficiently. So what I might do is go grab a wheelbarrow and toss the rocks in there, as many as I can fit in there, then wheel them over. I've made fewer trips. I've had to lift and hold, with my bare strength, all of those rocks for less time. So now I have more strength available to me to do other things, right? I've reduced my workload in the process, right? That was dealing with the inefficiency. Now, what if it was waste? Well, imagine if I said, the boss isn't there, I work for a landscape company, and I decide, yeah, I think the boss probably wants those rocks moved over here. So then I go through the effort, and it doesn't matter how the effort plays out, whether I use, just my brute strength and carry them over one by one, or if I use a wheelbarrow. Well, the boss may show back up later and go, why are the rocks over here? And I might say, well, I thought you were going to want them over there, so I moved them, just trying to get ahead of the game. And he might say, no, we can't have them over there because, you should have looked at the drawing or whatever, but they need to go over here in this part of the yard. So you took them to the wrong spot. That's a waste. It shouldn't have happened in the first place, and it provided no value, even if it was inefficiency, right? So I think of, you need to know, where's the inefficiencies? How can you resolve them? What's causing them? And then where's the waste? Where are we spending money, time and resources where we don't need to be spending it? How much is that? How many people do you got standing around waiting for direction because maybe their job requires, approval for pretty much everything they do. And so when they get done, if their supervisor isn't present, they may have to just sit there and wait for them, right? Well, that's wasted time. Something like that. I'm just kind of making stuff up off the top of my head just so that you'll get the point. Now, this issue of waste was my issue with that recent legislation on the podcast episode where I talked about Jacksonville and where they wanted to stop taxpayer funding of services for illegal immigrants. Now, when you talk to a libertarian, if you say, we want to stop spending taxpayer money, we love that. You will like never get us to be like, no, please spend that money. Please tax us more. In fact, we will never say that. We might prioritize some and say, I'm not worried about this presently. I'm worried about this other issue, and that's the one I'm going to focus on. So we may prioritize, but we will never say, no, please don't tax it, or please tax us. Please don't take away the tax. Well, in that particular case, the bill's author, Councilmember Diamond, he admitted that they didn't know how many illegal immigrants were even using services or which services they were using. And that was important because, well, they made exceptions for certain, like hospitals that are required by higher law to treat people when they come in for an emergency, but they still receive funding. So if an illegal immigrant comes in and they've got like a stab wound, they accidentally stabbed themselves in the leg while they were cooking dinner, but they stabbed themselves in the leg with a knife, and then they're in the hospital, they can't be like, okay, well, the law says I can't treat you if you're an illegal immigrant, because there's a higher law that says if somebody comes in, you have to make them ambulatory in order, by law. So they made exceptions. But what if that was the greater portion of all that taxpayer expenditure? Well, then guess what? You have wasted legislation because you don't have all the facts. But they forged ahead with the idea that they could address abuse without any details of how that abuse occurs or at what cost. Same concept is happening here. That, by the way, it did get vetoed by the mayor, but part of a longer story. You can go check out that episode. But anyway, but even after they had the conversation, the city council, they voted on it. They supported it. They sent it to the mayor's desk. It did get vetoed, but it would have been wasteful. Just in the same way, where if you're telling people, "Hey, there's waste here. We're going to do something about it," and then you don't tell them what the waste is, so that we know you know what the problem is, and you know what not to do or what to look out for, then there's no guarantee that you won't end up having the same problem in your policy ideas. That's a vitally important question to ask. All right, let's go back to this proposal here. All right, and then if you're looking at the proposal, you can see where he's kind of drawn out a little sketch here, a little diagram. You got your Department of Community Safety. It's going to have the Division of Public Safety under it, Division of Victim Assistance and Community Repair, Division of Community Mental Health. Those three categories, and then they've got multiple categories down below under which with it. So he's centralizing things. Okay, fine. Let's continue on. The next point that I have here, to do page 3. Let's see here. Go down here. Okay. So this one was really interesting to me. So mental health needs have increased in New York City. Research suggests that in recent years, a greater percentage of adult New Yorkers have experienced problems functioning due to negative emotional or mental experiences compared to before the pandemic. It's interesting. As of 2022, 13% of New York adults have depression. Furthermore, 34% of New Yorkers with a diagnosed mental illness report unmet mental health needs. I'm going to talk about that. An example, not receiving as much treatment as they needed, not receiving as soon as they wished they had, or not easily accessing it at any point due to cost. So that link there, 34%, I just clicked on it earlier, and I went and checked it out. And you might find this interesting, what I found. So here it is up on the screen for you to look at. 70%, and this comes from the report that they linked to for the 34%. 70% of New York City adults with a diagnosed mental illness have received mental health treatment, counseling, or medication, or both in the past year. Unmet need for mental health treatment includes people's perception of not receiving as much treatment as they would have wanted. I'm going to read that again. People's perception of not receiving as much treatment as they would have wanted, not receiving it as soon as they wish they had, or not easily accessing it at any point when they wanted it. Among New York City adults with a diagnosed mental illness, 34% have had an unmet need for mental health treatment in the past year. Now, I like that they defined unmet need. One of the things that drives me bonkers when I read something and a term is not defined clearly so that I understand what does the person reporting this or presenting this mean or understand this to mean in this body of information. And you might be surprised how many times you might think, oh, they must mean this. But then you dig into the study and you find out they made their own definition for something. And that's not necessarily a bad thing. When you're doing a study, you're trying to put together information. So I'm not saying that people are doing anything nefarious necessarily. They might be. They might not be getting the results they want, so they may have to put things, group things together. Or they might just say, hey, for the purposes of the study, for whatever reason, we believe that these things need to be grouped together, and this is appropriate for what we're researching. So there's good reasons and there's bad reasons for it, but you should know this, and you should be on the lookout for definitions and what do they mean. It's especially critical in law. Whenever you read legislation, there are frequently definitions that do not align with what the common person might say. If you ask them and say, what does this mean? They might say, oh, like for instance, in this case, unmet need. If you say, well, if it's an unmet need, we might assume that by need, we're talking about, say, a doctor has said, you need to do this, right? Or this, a doctor may concur and say, this was in fact a need. But in this particular case, need could just be somebody's perception of the amount of treatment that they had versus what they wanted. And that treatment, that amount might make them uncomfortable. And it could cause very serious problems. It's all over the place. You don't know. For one person, it could be, a mental breakdown that leads to violence. For another person, it may just require taking a sick day, And I'm not trying to downplay that. Like, if you have mental health issues to the point where you have to take days off, that is certainly a problem. But it is definitely not the same as if you have a mental breakdown and you might harm yourself or somebody else. Those are two entirely different things. And we are talking about safety. This is under his platform policy for safety. So not every mental health condition is a safety issue. Okay? So, all right. Those questions that I just asked, this is where we have the value, asking questions. So if New Yorkers are facing increased mental health issues, more so than pre-pandemic times, then a reasonable set of questions needs to be asked. For instance, how many more? How many more, like what increased, like when we say it's increased mental health issues, increased by what? And you have to be careful with the statistics. Somebody might say, oh, it's increased 100%. Well, if you go from 1 to 2, it's increased 100%. Right? So that's not, so you have to have the numbers as well. You can't just have the percentage. Because, if you have 100,000 people, then 34% is quite a bit. It's more, especially if you're talking about a whole society, right? But it's different if you're talking about 10 people. 34% ends up being 3.4 people. You can call it 3 people or 4 people, however you want to, round that. But point being, and 4 people still might be a lot out of 10. But then the question is, okay, what out of that 4 people, how many have a significant risk of danger to themselves or somebody else? And it could be the case in that set of 10 that all 4 of them do not. The likelihood, though, if you're dealing with 100,000 people and then you have 34%, well, then the likelihood that you're going to have some people that are physically a danger to themselves or other people, that rises as well. And you don't need but 1 or 2 to cause a really serious problem. So you understand how this works and why we have to start asking questions? So we have to ask, how many more? We also have to ask, and by the way, I want to point this out. Let me back up here a little bit here. So at the bottom here, it says, it has an asterisk. Oh, no, it says number 18. So if you go to the citation, the 18th citation there, it says New York City Neighborhood Wellness Survey. So it's a survey where people voluntarily said, I'll sign your survey, I'll fill it out. And the problem with that, the problem with surveys is that it kind of, they're based on people's perspective, which may or may not match up with a clinical evaluation. Okay? So you may come to me and say, DL, did you ever have a need for mental health that you just, was unmet? And I might be like, yeah, there was that time I didn't have insurance and I was just, my dog died and this happened and I was so stressed out and I was having trouble dealing with it and I really could have used a therapist at that time, but I didn't get one. And then you might say, well, DL, how'd you handle it? Man, it was a rough few days, but I got through it. Okay. Well, again, back to my comparison, that's a far better situation to be in than, hey, I needed mental health services, was unable to get them, and then I ended up harming myself or somebody else because I had an episode, right? 2 entirely different things. But this is the problem with surveys, right? Because we don't know if what somebody is saying on the survey in this particular case lines up with a clinical evaluation. Somebody in a clinical evaluation might say, okay, I can see where you wanted more, but you didn't really need it. We talked about this, Sam. You need to start learning how to go through the process and, remind yourself all the things that we talked about, bring those up, make your comments, say your sayings or whatever, those things that you might do to try to remind yourself, to bring yourself out of this negative position that you're in, right? So a clinical evaluation might say, you didn't really need it. We've actually been talking about you not using it, right? How many of those? I don't know, right? And I'm not saying that this was to be expected out of the whole group. All I'm saying is I don't know how many. I don't know if it was a small amount or a large amount. Most of them, I don't know. Another issue with surveys, oftentimes, those who are willing to fill out surveys are often those for which the issue at hand is more important to them. In other words, they may be willing to talk about it more, right? So, again, back to my little scenario where, like, I'm going through a whole bunch of stressors. You know, I've got deaths in the family. I've got, maybe I got fired from work. My car broke down. My AC went out. I'm stressed. The wife and kid are wondering, how we're going to have our next meal. I'm super duper stressed out. And man, it would be great to have somebody to talk to right now, but I don't have, insurance. So I don't have the resources to access this mental health services so that I can at least, kind of be brought back down to earth and have my anxiety, kind of reined in a little bit, right? But I also might later, if you ask me and say, well, did you get through it? And I go, yeah, I got through it. It was a rough few days, rough few weeks. But man, I got through it. No harm, no foul to anybody. It was uncomfortable. Maybe I yelled at the wife a little bit and I shouldn't have, and I had to apologize and, do dishes for a whole week or whatever, whatever the case may be. All right. But nobody was ultimately harmed. Okay. And so if that's the case, then I might also be like, I don't really need to fill out a survey. Right. So you don't get my perspective in that survey where I might, so it could be more than 34%, or it could be a high number because of those people that have a diagnosed mental health issue, anxiety, bipolar, whatever, right? If somebody has that and they can't access the resources that they need, but they're also the kind of person that's willing to talk about it, that may inflate the number, whereas some people might not be willing to talk about it, and they might say, well, yeah, I didn't have access to it, but I also recognize that I didn't need it either, right? So it's not giving you a good sample. Surveys are notoriously bad for that very reason, because the people that are willing to take them may be skewing the results overall, right? And there may be people that have there may be a lot of people that had diagnosed mental illness and they didn't have a problem. And so you didn't get their answer. And because you didn't get their answer, that 34% is larger. It might actually be 24% or 14%. Had all the other people who didn't have a problem taken the survey and said, yes, I have a mental illness. No, none of these apply to me. So that's the problem that we have to be careful with when it comes to surveys. All right, let's continue. What else? I kind of did these a little bit out of order on my show notes here, so I'm kind of looking at them, and I don't know why I jumped around. I did it because, I did. I don't know why. But the idea is that, it's a deceiving number, so we have to be very, very careful, and we have to make sure that we understand the definitions of, what does unmet mental health issue mean. Okay, so let's move on. Let's move on down the line where we've talked about that. And so let's see, where do we go here? Boom, boom, boom. Okay, so we're going to scroll down here to, what do my notes say? Page 5. So let's go to page 5 here. All right, such models have already been used in New York City with success. So they're talking about models that have been used at a smaller scale, and they've seen positive results out of them. Now, by the way, this document links tons and tons of links. So I was not able to go through all of them, and I'm only going to talk about the ones where I at least click through, or I will disregard any critique of the study itself. Okay. We're going to try to be honest about this. We're not going to do this whole, he's a socialist, it just won't work. We want to bring attention to these ideas in the right way with facts and evidence on our side. So they're talking about different models here, but it's time we invested further. 2016 New York Connections 2Care program served over 40,000 New Yorkers through 15 community-based organizations. One study found that the program decreased barriers to mental health access, including internalized stigma of mental illness increasing mental health care access by 10.6% and reduced use of inpatient mental health services by 23.7%. So in other words, like, look, this study over here showed that this particular program provided results such that we had a reduction, we had increase in access of these of this healthcare, but we've also had a reduction in inpatient mental health services. In other words, you're going to reduce your cost. You're going to basically say, instead of going over here and utilizing this resource, which may cost more, I'm going to use this resource, which may cost less because you're maybe dealing with a mental health issue before it gets out of control, right? So you're dealing with it earlier, and so therefore when it's earlier, it tends to be a little bit cheaper. You know, maybe somebody with less experience is more able to assist you. Whereas if things blow out of hand, you might have to have the big guns, if you will. You might have to have a psychiatrist who's very experienced for when things get out of hand like that, right? Or whatever the need might be, right? There's a variety of them. Despite an existing implementation guide to expand task sharing programs, the city has yet to implement anything comprehensive. That's interesting. So I want you to think about this. And this was part of my critique in housing, is that there's a long list of failures on part of the government. So why would you give government more control, more money, until we have addressed the failures? And I don't think it's appropriate to simply say, okay, well, they failed at it, and we're not going to look into why. We're just going to create this new program, and this new program, this one's the one that's going to do it right, okay? Because otherwise, you end up risking becoming a new program that accomplishes the same amount. That's not good for anybody. So I agree that getting people the mental health care that they need can improve many things. So I'm not disputing the idea that there are programs that are successful. But in this case, it is listed under safety, and nowhere in this proposal does it reconcile unmet needs with violence or crime. So, right, and this is why I'm picking some of the ones that I am, because I want you to recognize and see, okay, there is a wide range of people with mental health issues. Some of them contribute to violence. Some of them do not. And if it's under the plan of we're going to make New York safer, then it seems reasonable that we should look at it and say, okay, the items that you're pointing out should have a direct relationship to the violence that we're seeing in our city. And so therefore we know you are addressing the right thing that will hopefully decrease crime. It's one thing to say, hey, people need health care, and we need to do a better job of getting the health care where it needs to be, especially if we're talking about getting somebody health care early on when it may be less expensive and more impactful. That's the more important part, but more impactful than waiting until things blow up. And then they have to, have somebody that costs more money because there's fewer people that are capable of dealing with the situation where it currently is. So I'm good with this idea of that. But again, it's under safety, and I'm not seeing anything that says that's linking mental health issue with the safety issues that they're having. Like, remember the knockout game? You saw that in major cities. Young men would go up and just, randomly walk up behind some old person, and then just their goal was to punch him one time and try to knock him out in one punch. And some people got very seriously injured. Is that violence related to mental health? Is somebody having a bad day and say, F it, I'm going to go out and I'm just going to go punch this guy in the fucking head, and wow, my mental health is now going to be so much better? I've resolved it for the day? No. I think they're just a violent person. They need to be locked up, right? Or they need to meet somebody that can take a punch and knock them out. Or, perhaps even worse. Because, violence against other people is immoral. So I have to ask these questions, because at the end of the day, I agree that we want to address mental health, and I want to do it right. I don't want proposals that sound good and deliver little. That's not acceptable. You shouldn't want it. Neither should anybody else. Okay? And so we're not trying to diminish the needs of people. I agree there are needs, right? But if a politician is talking about limiting crime by addressing mental health, they should be able to tell you what percentage of crime is related to mental health issues. how his or her proposals will improve mental health and therefore end up reducing crime. Mamdani hasn't done any of that. It's presented in this as if addressing mental health will just automatically reduce crime. We have to make this assumption and then free up officers to deal with violent crime. And now I will say this, part of his proposal is one that I can actually appreciate, because he talks about, he's like, look, he like, if you watch his videos and watch what he talks about, he says police officers don't always need to go to certain calls because it's not the appropriate type of person to send to that call. If I call up and I say, hey, my spouse is, they're bipolar or they have schizophrenia and, they're really acting out and they're kind of in a violent rage right now. They haven't had their medication. I really could use somebody. Yes, in a sense, you do need police because you might need somebody that can apply force if necessary. But what you really want is somebody that can de-escalate the situation, who understands, hey, this is a mental health episode. And if we can get this person back down to earth, back to being rational, or at least subdue them, then we can get them on their medication, and then they will be back to where they're supposed to be, functioning in society well enough, right? We don't necessarily want to send an officer who is not trained for that, and so their only option is to pull their gun. And that's unfair that's mostly the victims, right? The person that's, because it could be a family member, and they don't want to see their family member necessarily shot or killed. It's unfair to the person in question, right? It's unfair to the officer. It's unfair to society. It's unfair literally to everyone to send the wrong person. So I agree with him that we want to send police officers to chase bad guys who commit violent crimes. That's what we want to do. So I don't think he addresses the mental health so well, but that's where it is. Now let's go down the line here. And I'm going to try to hurry up a little bit because I do got a hard stop here in about 20 minutes. But I think we can get through the rest of this pretty quickly. So we're going to go down to page 11, right? Yeah, page 11 here. Skipping on down. We're not going to, again, it's a 17-page document. I'm not walking through every single thing. That would just be silly. So we're talking about gun violence. All right? Now, this is where I think I'm sitting up in my seat. It's kind of like, for libertarians, talking about gun violence and the arguments, to support gun restrictions, we sit up and it's kind of like I'm trying to think of how to say this exactly because I think it'd be kind of amusing. But libertarians respond to the idea of addressing gun violence arguments in the same way that your girl might tie her hair back behind her head when it's time. You know what I'm saying? We get prepared. We're like, okay, this is happening. Okay, maybe that wasn't that funny. I tried. Okay, look, it's the reason I'm not a stand-up comedian, because I can't do comedy. But anyway, the DC. Okay, let's move on. Let's just pretend like that didn't happen. That's a bad joke. Maybe the next joke will be good. We'll see. I don't know. I don't think I have any more for this, but the next time I do a joke, maybe it'll be good. The DCS will ensure we continue to reduce gun violence using evidence-based crime reduction strategies that are proven to keep communities safe. Total cost for these investments is $337 million. Great. I want to know what you're doing for $337 million. While gun violence has been decreasing across the city, it remains a crisis, one concentrated geographically and racially. 2/3 of the city's shootings happen in the poorest neighborhoods, which are predominantly Black and Latino. Okay. Why? What's going on in those communities that's not happening in other communities? Other than pew, pew, pew. Other than that, right? What's happening? I don't know. Let's continue on. There's another comment here another highlight that I want to address here. Down here. So this is where it's getting interesting. So he says, increase the funding. So the DCS will increase the funding dedicated to the crisis management system by 275%. This will allow for doubling funding for existing CMS programs, which operate in neighborhoods where over 50% of gun violence occurs, expanding the crisis management system into further areas experiencing gun violence, providing gun violence interruption programs with greater resources and flexibility for their interrupters, such as those of Newark, establish wider gun violence prevention programs that focus on workforce development, youth mentorship, and revitalizing community spaces. Build on successes from MAP and building healthy communities, including NSTAT. Bring the Violence Prevention Initiative, currently under DOH-MH, into the crisis management system, increasing funding to expand the program to every hospital located in communities at high risk of gun violence. So it seems like I'm sure that there are probably some more gun control measures that he likes, but here it looks like he's saying, here are some programs that have shown some value. And what it really feels like he's saying, okay, something positive, do more of it. And that kind of sounds intuitive, right? Like, hey, if it's doing well, then do it more. But again, the question is, why does it work? You know, that's important. Why it works. What is it about these programs that explicitly make them work? And if you expand them in government, then the bureaucracy of government, which we just talked about, which we can always talk about, how will that affect these programs? Will these programs stop being effective by virtue of having government bureaucracy applied to them, right? Because when you start adding more money, what happens? More people want in on it. And when more people want in on it, they fight for things. They try to get their way. They try to get the glory. They do all these things. And they may be counterproductive to what you're trying to accomplish. So I don't have a problem per se with these programs. We'd have to look them up individually. And I think this is something that New Yorkers should do. They should look up a few of them and say, what do we think about this program? Do I like this program? Does it work, without government currently? Or is there a limited amount of government involvement? Okay, what's going to be the consequence of adding more government to the mix? Is it going to potentially screw this all up? Do we want to do that? Or are there ways that the government could say, let's make it easier for you to operate, and then you can do what you do and do it better or more efficiently with more money, whatever the case may be. Generally, when I look at situations like this, what I find is that the government just needs to either get out of the way or stay out of the way. And then at best, and this is the case very often, they can just go, okay, let's reduce barriers so that others can come up with equally effective ideas. And so rather than relying on this one and making this one the big one in the city, well, then what we can do is just say, you work on your area, you work in your area of responsibility, you over here, and you guys do good things. We're going to support you from afar and mostly from non-interference. That's how we're going to support you. And from a libertarian perspective, we could go down and I could probably spend a whole entire episode talking about where the private sector has clearly outperformed the public sector government. Clearly, right? And I don't see any reason that it wouldn't apply here. And the fact that he doesn't seem to be highlighting all these, gun legislation and restrictions, and he's actually saying, okay, there are programs that are already working and they're helping to reduce gun violence. I think that's a good thing. But I think he needs to know why they are effective. All right, the last thing that I want to get to here, and this is over on page 14 here, is hate violence. This one gets interesting. All right, the DCS, I'm going to read up top here, and then I'll read the highlighted part just so it makes sense to you. The DCS will further a vision of New York City that is free from hate violence, especially given rising anti-Semitism, Islamophobia, anti-black racism. By the way, that's a little on the redundant side. You could just say racism against blacks. You don't have to say anti-black, because racism towards a black person would literally be anti-black. It's redundant. Anyway, anti-Asian hate crimes and LGBTQ plus hate. No one should experience violence because of their race and ethnicity, religion, sexual orientation, or gender identity. I agree. I'll take it even further. Nobody should experience violence unless they are committing aggression against another person. Ever. Doesn't matter. Even if it wasn't mentioned here, if you are not committing aggression against somebody else, you should not have to worry about experiencing violence, period. Hate violence is not just an individual problem. It is a collective one. Okay, so now we've just made every libertarian that might be listening have their head explode. Because if there's one thing that they hate, it's when the word collective is used. Why? Because we believe that the individual is the utmost importance of everything. It is the foundation of our philosophy. You own yourself. Everything from there either submits or is in violation. All right? So I would argue that hate violence is really an individual problem. Because if I go out and I do something against a group, now more than likely I'm picking one person and I'm attacking a single person, or I might be attacking a couple of specific people. And I'm just simply not capable of hitting every single person. I might be striking fear. You know, if I go out like the guy in Colorado that was throwing Molotov cocktails at Jewish people, terrible, despicable person, right? He couldn't physically attack every single person that's Jewish, but he was able to attack at least a few that were within vicinity. So I would argue that he attacked individual people. Now, his animus might have been Jews in general, but he can't collectively attack all Jews. You might say, DL, you're splitting hairs there. But I think it's important to distinguish when it's an individual, because at the end of the day, here, I'm going to break it down super duper simple. This is why, and this may be the better argument anyway. For the individual, rather than saying it's a collective problem, the reason that you might attack somebody else without having experienced aggression from them, so it's not self-defense, is because you have determined at least that particular person is lower than you and worth, or it's acceptable to commit an act of violence against them. That's ultimately what it ends up being. So if you attack 3 people, you have said that person, and that person, I find it acceptable to harm them. And so you have specifically looked at individuals and accepted committing acts of violence against them for whatever reason that you've concocted. Oh, they're Jewish. It doesn't matter that they're Jewish. What really matters is you looked at a person and said, it's acceptable for me to commit violence against them. And then you did. So for me, it still goes back to the individual. Hopefully that makes a lot more sense to you. Anyway, he goes on, and city government must be invested in not only being part of the solution, but ensuring we dedicate the necessary resources to preventing hate violence from occurring. I don't necessarily disagree. I think we should do everything we can. Well, let me rephrase it. I think we should really look at how can we reduce violence? What kind of things do we have the power to do? Now, we can't force it, right? And I'm skeptical of a lot of legislation, but that doesn't mean that I don't think there aren't ways to achieve it. So, for example, I've talked about this before. I used to mentor. I mentored a kid that was at risk here in Jacksonville, a couple of them actually, right? That's something that we can do to reduce future violence, because a kid that's growing up without a father may hang out with the wrong crowd and not have a father to yank him back in line, right? So he had me, not a father, but a father-type figure that was working with him, giving him life advice, explaining why things are good or bad, explaining better answers and ways to address issues that he faces. That's what I did. And to my knowledge, he's never committed an act of violence. And he's now like 22 or 23, something like that. Might even be a little older. Okay. And so ultimately at the end of the day, I contributed. Now, was it possible that without a mentor, he would have never gotten into a violent altercation? It's possible, right? But I did my part in helping to ensure it. And so we can find ways to do this, to reduce hate violence or any violence as far as I'm concerned. I'm saying hate violence because that's what it's titled, but I'm not saying hate violence because I necessarily agree with the idea. I disagree with it, but I'm using the terms that he's using so that it makes sense when I'm talking. All right, so let's continue. He goes on to say, the DCS will oversee increasing funding for hate violence programs from $3 million currently to approximately $26 million, an over 800% increase. Hate violence has increased across our city with 669 hate crime incidents in 2023. This spike represents a record high over a 10-year period and a 12.6% increase from the previous year. Islamophobic and anti-Semitic hate crimes are on the rise. NYPD data show a 73% increase in anti-Muslim hate crime incidents in 2023 compared to the previous year. 65% of all felony hate crimes targeted Jewish New Yorkers in 2023, and all but 14 of 145 incidents of aggravated harassment in the first degree were committed with an anti-Jewish bias. This line got me. In addition, gay men, black New Yorkers, and Asian New Yorkers were also some of the groups most targeted by hate crimes in 2023. Hate crimes remain underreported to police departments, and these numbers do not fully convey the scope and scale of hate-fueled violence in our city. So that line got me, and I don't remember which link I clicked on. I would tell you if I did, but I just can't remember because I had a bunch of links open, and then I made a mistake and forgot which one I was specifically clicking around with. But that led me to this document here. Let me pull this up on the screen, this website here. So here we go, and bam. Assessing impact of AAF's Hope Against Hate campaign. Now, this website is Asian American Federation. I've highlighted two parts, and I want to point this out. The rise in anti-Asian violence during the COVID-19 pandemic exposed both the deep roots of structural racism, the lack of resources for and information about Asian Americans experiencing anti-Asian bias incidents in New York City. Anti-Asian hate crimes reported to the NYPD rose from 28 in 2020 to 134 in 2021, an increase of 375%. In total, there have been 251 reported anti-Asian hate crimes to the NYPD from January 2020 to March 2023. Okay? It gets really interesting. A few paragraphs down. Anecdotes shared with AAF mirrored reports made to stop AAPI hate, a California-based national coalition that was formed by community organizations and academics in March 2020 to track and respond to bias incidents of discrimination against Asian Americans. In 2021, I reviewed a bill called the COVID-19 Hate Crimes Act. And this one was based on that Stop AAPI Hate report. And I walked through it. I want to show you the clip of that. I'm going to remove me from the screen since I'm actually on the screen. There's no reason to have me on there twice. But I'm going to remove me. It's like a 2-minute clip. So let's play it. Never mind, it doesn't look as good as it does now because I've improved my game since 2021. So here we go. It goes on to state, according to a recent report, there were nearly 3,800 reported cases of anti-Asian discrimination and incidents related to COVID-19 between March 19, 2020 and February 28, 2021 in all 50 states and the District of Columbia. Whew, that certainly sounds like quite a bit, right? But what does that 3,800 number mean when it says discrimination and incidents? Well, it turns out we can look at the report, which comes from Stop AAPI Hate. That's Asian American Pacific Islander hate. On page 3 of their report, it shows that of the reported incidents, 68.1% were verbal harassment or name-calling, 20.5% were avoidance or shunning, and 11.1% were physical assault. The report then cites specific examples of the above categories. I'd like to read one from each category. Okay, so we're going to start with verbal harassment or name calling. Okay, so here's the report that was given to Stop AAIP Hate. I was shopping in Milpitas when an older man started making faces at me. I asked him, what was wrong? And he said, what's wrong? You are out here shopping. I was confused, and he followed up with, we delisted your companies, shipped back your international students. When do you ship out? When do you ship out? We are going to take away your citizenship. Now, let's go to the next one here real quick, and we'll talk about these in a moment. Avoidance and shunning. Here's that story. I came into the coffee shop at Mercado, and people started leaving the area where I sat one by one. People started coming in, and they sat on the other side of the coffee shop away from me. I became isolated on one side of the coffee shop. And now, let's hear from the physical assault story.
My boyfriend and I were riding the metro into DC. When on the escalator in the transfer station, a man repeatedly punched my back and pushed against us. At the top, he circled back toward us, followed us, repeatedly shouting, "Chinese bitch," at me, fake coughed at and physically threatened us. A few days later, we saw a news story about how the owner of Valley Brook Tea in DC was harassed and pepper sprayed by the same man who had called him COVID-19 repeatedly.
Okay, so what do we learn from that? We learned that this was, again, self-reporting. So all the things that I talked about earlier about self-reporting, they apply here, right? People reported and said, hey, this happened to me. And then they documented and they added it. I don't remember the exact numbers, but it was like 11% of all the things that were reported would actually be a crime. The rest of them were just people being unpleasant. Like if one of them was go to a coffee shop and I sit down and then people walk in, they look at me and then go sit on the other side of the coffee shop. Okay, well, that's not a hate crime, nor should it be even considered a hate crime, nor should it be in the doc. Like that should have been removed and said, yeah, that one doesn't count. This one doesn't count. And then, but if you remove many of these unpleasant interactions, then it's not going to make for a great story, right? It's not going to make for, hey, we need to pass this legislation. So I found it kind of interesting because now I have to wonder how many of the statistics that we just saw from where did it go here? Put it back up on the screen here. How many of these statistics apply with that same issue, right? 73% increase in anti-Muslim hate crime incidents. Were they actually crimes where like somebody was actually assaulted, spit upon, threatened, right? Those kind of things. Or was it somebody just being, uncouth and foolish? Like, hey, go back to your country. Okay, that's mean-spirited. You shouldn't say that. I would oppose it, and I would criticize people for saying it. On the other hand, it's also not a crime, nor should it be a crime, nor should it go into a statistic that tells us that crime is on the rise. We have to have what actually is on the rise, and then we can deal with those. This is part of asking the right questions so we get the right answers, so we apply the correct solutions. So I thought it was interesting, and I wanted to point that out just because the data doesn't really indicate that there are crimes for the government to resolve in many cases. And this is literally all under Mamdani's safety platform. Okay, so I keep going back to that. So now, and I want to point out, it's not that they don't matter. It's not that we don't want to. Hey, let's get people to be a little bit nicer to each other. I think that's a great thing. We shouldn't say, like in there, somebody called someone a Chinese bitch. You shouldn't say those things. But that's also not the government's role. It's not the government's job to tell you to not say naughty things or mean things to somebody else. That's not their job. Their job is to deal with crime, physical assault, threats. I will hurt you, stuff like that. And we have to learn to separate the two, but we're not. This is my big problem with the hate crime. When you look in the hate crime data and you look at statistics, every single time that I have looked so far, you have a mix of those very things. I'm willing to bet the same thing applies in New York City, right? And it's important, again, I reiterate, if you cannot ask the right questions, you will not arrive at the right problems, which means you will not get to the correct solution. If Mamdani is going after hate crimes and there's an argument to be made that those hate crimes are questionable in terms of crimes, then it undermines his ability to provide good and meaningful solutions. And if he's failing to do it in one area, then we have to reasonably ask, is he failing it to do in another area? Will we get the same government that we have now? Just looks different, maybe has a different face mask on. So how would a libertarian handle all of this? I can summarize it very quickly. Number one, we would shift as many resources as we possibly could to delineate between crimes and non-crimes. We would shift the burden of non-crimes to the private sector. Okay? Hey, you're a mental health professional. Are you willing to go out on a call with the police officer, and the police officer will sit back behind you while you deal with the person, and then if it gets to the point, the officer will come in and at your direction do what you need to be done. Are you willing to do that? Great. Okay? We're going to call upon you when needed. Maybe you pay for that person. Maybe a private organization pays for that person, like a local organization. By the way, you could do that much easier if people weren't taxed so damn much. Taxation is theft. Stop taxing them so much. And guess what? People love giving money to support their fellow man. Billions and billions are given to charity every single year. Okay, for every charity that you can think of something. There's a charity out there somewhere. Another thing a libertarian would do is we would provide the police assistance as needed. Okay, again with mental health, as needed. So that might mean you get call centers that learn to distinguish and ask the right questions so that they can send the right person, so on and so forth. We would thoroughly identify what inefficiencies exist, why they exist, and we would ensure that no future solutions follow the same path so that we at least don't get the same problems. At least get a new problem to deal with, at a minimum. Because otherwise, why spend all of this money running a campaign, people donating, voting, getting excited, arguing on the internet, if all we're going to get is more of the same? Why? That's inefficient itself. And then the last thing, we would be very transparent with all of our information. That's like if I were a mayor, I would be doing my best to give the citizens of whatever city, no, folks, no, I'm not running for mayor, no. But if I were a mayor, not running, if I were a mayor, I would do my best to make sure that I give the citizens every bit of information that they need possible. I would do, I feel like government, what they do is the exact opposite. They try to hold on to information. It's almost like, you might have that coworker who bogarts information, because if they give the information to everybody else, then it might kind of say well, why do we need this guy? I feel like government is that guy. They're bogarting all this information so that we don't find out, it turns out we don't really need you that much, or we need you a lot less, or maybe in some cases, not at all. So that's how I think a libertarian would handle the situation. And it mostly, my criticisms, it's hard to criticize ideas when you don't have all the information, right? Because I don't know what needs to be addressed. I don't know which statistic is a good statistic, that if I looked at it, that I would come to the same conclusion. And so this is my biggest problem with the campaign, is that there's a lot of information out there and it sounds really nice, but at the end of the day, there are still a lot of questions that aren't being answered. And we need to know. And the most important is, how do we know that you've identified the right problems and you're going to apply the right solution? Let's just say that it is more government against, to the chagrin of me at any day, at any moment, right? Any moment of any day, right? But let's say that you do that. You can at least make the argument for me harder if you have the right information, which leads you to the right problems, which leads you to the right solution.